Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with medical school student Cook-Garard from the Cooney School of Medicine. And today we're going to talk about how COVID could be affecting your heart.
Our guest today is Dr. Steven Sinatra, a cardiologist and psychotherapist who has co-authored and published a paper on personalized nutrition for the COVID-19 era with the American Nutrition Association.
So today we will find out about the connection between the heart, lungs, and COVID-19, as well as precautions and preventative measures to take for people with pre-existing heart conditions. So Dr. Sinatra, welcome to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. Welcome.
It's good to be here, Jeanine. And it's nice to talk to somebody from Long Island. That's where I grew up. So this is kind of fun and cool, you know?
I like it.
Absolutely. So first off, how are you doing?
I'm doing fine. I mean, as far as I'm concerned, I'm in my early 70s and, you know, I do have a comorbidity being a male and being in my 70s. But when it comes to COVID, I take a lot of, you know, healthy foods and a lot of targeted nutritional supplements, and especially like vitamin D, I think is awesome. And we can talk about that later. But I think the key to COVID going forward is use it as a reframe. In other words, this is an opportunity for people to take responsibility for their own health. And a case in point, if you're a mere 10 to 15 to 20 pounds overweight, it makes sense to lose weight because we know that type 2 diabetes is a major comorbidity when it comes to COVID. So if you take away the home where fat cells, you know, with inflammatory cytokines live, they live in those fat cells. If you take away the home, then the inflammatory index goes way down in the body, and that's what you want.
So you haven't been negatively affected by COVID?
No. Everybody in my family is good. I have lost friends, though. I'll be honest. My editor for my Heart Sense newsletter, Marty Zucker, and he was a co-author on my Earthing book and a co-author on Reverse Heart Disease Now. Unfortunately, he perished from COVID. It's kind of a tragic story because I'm sure you've had other people tell you this, but you know, young children ages 10 to 20 or young adults can be carriers of the illness, but not have the overt symptoms of the illness. In other words, they can have a little runny nose, maybe a slight fever, but they can shed the virus, but then their immune systems are so robust that they don't get the virus, which is a good thing. However, if grandma or grandpa hug them, or if you have a compromised immune system, like my colleague Marty, because he had a chronic leukemia at the same time, then you know you run the risk of catching the virus from a younger person who is quote asymptomatic. So that's important to realize.
It's so important.
Just to get to know a little bit more about your background, what made you want to become a cardiologist in the first place?
I grew up in a family of diabetics. My grandmother was a diabetic and my mother was a diabetic. You know, my grandmother was overweight status, but my mother was slim and trim. And she got diabetes at age 38, probably from excessive corticosteroid use, trying to save the eye from glaucoma. That was the treatment decades ago. That's not the treatment today, though. But nevertheless, she developed what we call brittle diabetes at a young age. I was only about 10 or 11 years old. I used to come home from 4th, 5th, and 6th grade, and my mother would be sometimes in hypovolemic shock, very, very shaky, needed sugar, sometimes in insulin shock. You know, in other words, as a young boy, she relied on me to either give her sugar or even administer insulin subcutaneously via a needle. And I was a young boy. I mean, I think I was in 6th grade. 4th, 5th, and 6th grades was the time frame. And I asked my high school wrestling coach, you know, when I was ready to apply to college, I asked him, you know, do you think I could make it as a physician, as a doctor? And he gave me the confidence. He said, absolutely, do it. So That's how it all started, And
Yeah.
I just was a biology major at Franklin and Marshall. I was on their wrestling team, and I declared my major. And it's amazing. I got into medical school at the height of the Vietnam War because I thought I was going to Vietnam. I really did. I thought I was, but because I was a Division I athlete. And I had a 3.0 average at the same time back in those days, in college. I guess the medical schools really liked the fact that you had other activities other than being a bookworm, so to speak.
So with COVID-19, it's a very tough time for a lot of people. And I know as a cardiologist, you're also a psychotherapist. So what advice do you think would be good for people who are coming to the doctor, who are very nervous about this pandemic and very nervous about how their health is faring? What tools do you give them when they're going to the doctor?
Well, basically, the social distancing is important. The mask is important too, because if you're carrying the virus, the mask will serve as a shield, even though you have the virus. But again, like I talked about before, you can be asymptomatic with this virus. So, there's a lot of controversy on the mask. I could go both ways on this,
right.
But for safety reasons, I would say, wear the mask for now.
How about if they're nervous about the visit?
If they're nervous about the visit?
Yeah.
Well, a lot of people are, and some of the doctors are doing telemedicine. In fact, I spoke to some doctors there, and, like when I was a doctor in the office on a day-to-day basis where I'd see 40, 50, 60 patients, sometimes I needed to see those patients, but you know what? If the patients had a home blood pressure monitor, or if they gave me their weight, they gave me their blood pressure, if they had some laboratory data that they got back, on computer or whatever, you know what? You don't need to see them, especially if they're healthy. Now, look, if they're in heart failure, if they're symptomatic, if they can't breathe, or if they're having symptoms that deserve attention, well, then you need to put a stethoscope on their chest. You need to do some modifications, things like that. But I would say in the COVID day and age, I think 50% of office visits can be done by telemedicine. I really do.
So when specifically do you think telemedicine can be utilized? So is it under what scenarios do you think?
Basic scenarios. A patient calls in, "Hey, doctor, it's a year. I'm here for my yearly check." The nurse can say, "Well, how you feeling?" And the patient says, he or she says, "I feel fine. I'm doing okay. When was your last lab work?" And say, "A year ago. Do you have any results? Are you concerned about anything?" And the patient says, "No, everything looks good." I don't think they need to be seen. So that's the reframe of the COVID era. In other words, the reframe, it may reduce the necessity for what we call doctor wellness visits, so to speak. Not sickness. That's a different situation. If a patient calls up, "I'm dizzy, doctor. I passed out. I don't feel good. I'm short of breath." Those are warning symptoms that need to be looked at. But, a lot of people today, they have laboratories, tests they go over, things like that, and you can all do it by telephone. You really can.
Would you say that patients who have a pre-existing heart condition are more predisposed to the COVID virus? Or would you say that vice versa, if you have COVID, it will impact your heart? What is a heart-COVID connection there?
Yeah, it goes both ways. In other words, if you have any cardiovascular condition, Jeanine, even hypertensive cardiovascular disease, take women, for example, they can have high blood pressure. Women get what we call more diastolic dysfunction. In other words, they can have high blood pressure and their only symptom is shortness of breath or maybe fatigue. It happens more in women than in men. But if you have heart failure, that is a serious predisposing condition. That's really serious. That puts you behind the 8 ball. However, if you're a healthy type of individual, your high blood pressure is well controlled, you don't have any evidence or any laboratory evidence of cardiac enlargement, you have a normal sized heart, that puts you in a good situation, even though that, quote, you may have a comorbidity with, heart disease. Now, let me say this. The infection, if you get COVID-19, and the data has come out of Spain, Italy, France, all over, I can tell you, I've seen a lot of these papers. A lot of these people with COVID-19, they can develop myocarditis. which means, Celeb, you know this, inflammation of the heart. In other words, the virus gets into the mucous membranes of the nose and the mouth. They settle in the lung. We call it the ACE2 receptor. In other words, the virus locks into a receptor in the lung. Mm-hmm. But these same receptors are in the cardiac muscle. So if the virus locks into the cardiac muscle, or remember, the circulation from the lung is very close to the circulation of the heart. They share the same circulation. Right. That the virus can lock into these receptors. And that's why the European experience, as well as the American experience, shows that even if you survive COVID-19, the possibility of developing inflammation of the heart 2, 3, 4 months later is high. So in other words, if you do develop COVID-19 and you do develop shortness of breath or cardiac symptoms later on, you must, and I would say must see your internist, family practitioner, or cardiologist, just to make sure that your heart is not involved pathologically from the virus.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with medical student Caleb Garard. And today we're talking about the connection between the heart, lungs, and COVID-19, as well as precautions and preventative measures to take for people with pre-existing heart condition. With Dr. Stephen Sinatra, a cardiologist and psychotherapist who has authored and published a paper on personalized nutrition for a COVID-19 era with the American Nutrition Association. So do you put patients who have a cardiovascular history on a particular protocol? Since it is, we're in a pandemic, do you, in terms of nutritionally, in terms of psychologically, do you give them sort of preventative measures so that they are not having to be highly predisposed to COVID?
Great question. And that's the way I practice medicine for decades. I mean, I've always had the notion prevention is easier than cure. Preventing heart disease is really so easy. It is so easy. Once you get heart disease or a heart attack or, what we call atherosclerosis, if you get a stent or an angioplasty or bypass surgery, that's sort of like aspirin for a headache. In other words, you want to avoid the headache. You want to avoid what we call coronary artery disease or inflammatory heart disease, where we get atherosclerosis of the blood vessels, surrounding the heart. So an ounce of prevention is worth a pound of cure. There's no doubt about it. So what do I recommend to patients? First of all, the villain in our diet is sugar. No question. I mean, you don't want to be drinking sodas, for example. Like, if you go to a fast food restaurant and you get almost like a quart of soda, that's about 40 grams of sugar. I mean, that's like crazy. I mean, and the problem with America today, and I said this at the American College of Nutrition meetings and, the board of directors meetings, there's approximately 100 million diabetics in this country. They're either insulin dependent or type 2s, type 2 diabetics, or maturity onset diabetics. But the problem is we Americans, we eat too much sugar.
Yeah.
So the secret with COVID is this: if you can avoid the reframe, if you avoid sugar in the diet, eat more healthy fats like olive oil, avocados, more, coconut milk even, or in other words, more healthy fats and more healthy proteins and less sugar. This is key because we know that insulin that reacts to sugar elevations in the body, insulin in itself is a pro-inflammatory hormone, and insulin causes endothelial cell dysfunction, which is really the sine qua non of this COVID-19 because it causes disruption of the endothelial layer of blood vessels. So going forward, if people eat less sugar, more healthy fats, more proteins, get less of an insulin response, can lose 5, 10, or 15, 20 pounds, ride a bicycle, walk the dog, take walks, do a little swimming if you're in warmer weather. I mean, if you can bring exercise to the table and have a non-inflammatory diet, and then you can also take targeted nutraceuticals like I take on a daily basis as well to strengthen the immune system and offset the diet, the ravages of the virus as well. You
talked about supplements. What supplements are you on, or do you take? What you recommend?
Oh, geez, I take a lot. I mean, first of all, I take coenzyme Q10. I mean, okay. I've been a pioneer in coenzyme Q10. I've been using it for 40 years. I met all of famous researchers, Fred Crane, Beliznikov, Carl Folkers. I mean, I was fortunate as a young doctor. I just rubbed elbows with the best scientists in the world in CoQ10, and I've published a lot on it. I've used it extensively in my practice. And I got to tell you, I think in my 50 years of almost being a medical doctor, CoQ10 is my greatest discovery. It does everything right. And the literature on CoQ10 is exploding right now. I mean, whether you're dealing with Parkinson's disease, or cardiovascular disease, or inflammatory disease. I mean, CoQ10, I think, is a magic bullet. So I would tell anybody over the age of 30 going on to take, 60 milligrams. If you're over 40, 100 milligrams. If you compromise, 200 milligrams of CoQ10. I also like vitamin D, Jeanine. Vitamin D and Caleb, this is so important. I mean, I've used vitamin D for decades. And when I was practicing day-to-day cardiology in my practice, I would always get serum vitamin D levels because I was practicing in Connecticut. Now, you guys live in the Northeast. And basically, you're not out in the sun a lot, like those of us in Florida, for example. People below Atlanta get more sunlight. And remember, when the sunlight hits your skin, it activates the cholesterol in your skin to form what we call cholecalciferol, or 125 vitamin D calciferol. So basically, you're forming vitamin D from cholesterol in the diet and the sunlight. Now, vitamin D is awesome because we know that if your blood level is like 15, what we call UGs per ml, that's very low, by the way. And if you catch this virus, you're going to get complications. That's what the data shows. But if you're at a level of 30 to 35, all of a sudden the complication rate plummets, and these people do well with survival. And I recommend levels of 40 to 60. So
how much vitamin D are you taking for that?
I take between 2,000 and 5,000 units every single day.
2,000 and 5,000 units. 2
to 5,000. In other words,
2 to 5,000.
Yeah, 2,000 units. And now, if you're taking vitamin D over several months or even a year, you can always check your vitamin D blood level. It's so easy. It's like drawing a cholesterol level. I mean, it goes to a lot of the labs in the country do it. But going forward, Jeanine, I think having a high vitamin D level, at least 30 to 35, because the data shows it protects you from COVID-19. It's a knockout punch. It really is. And I was delighted to see when the doctors at Walter Reed were treating the president with vitamin D. I mean, that was music to my ears because I thought a lot of the conventional docs would shine away from it or shown away from it, but they didn't. They realized that vitamin D is vitally important. So coenzyme Q10, vitamin D. I like a mushroom preparation. I don't know if you ever heard of it. It's called AHCC. It's a natural mushroom combination. And the reason why I like mushrooms, it contains the alpha glucans, beta glucan combination that it's an antagonist to what we call NF-kappa B activity, which is a pro-inflammatory cytokine. It's a messenger. So, I only take 1 or 2 capsules a day as a prevention. If I feel like I could get exposed to somebody, I would double or triple a dose. I take omega-3s. I think omega-3 essential fatty acids are really good, whether it's squid oil or fish oil. It doesn't matter. I love vitamin C. I take at least 1,000 units a day of vitamin C. I take it in a packet with glutathione. Because, vitamin C with glutathione and selenium forms glutathione peroxidase. This is, and Caleb, you may know about this. Glutathione peroxidase is the number one immune supporting enzyme system in the body. And the body makes it, but the body makes it from glutathione, vitamin C, and selenium. So, that's important. So there's lots of different supplements, people can take to really improve their immune system going forward. And it's not really rocket science. It's so simple.
So we talked a lot about it, like behavioral changes that a person can make, like supplements and like controlling like their diet and cholesterol, like behavioral changes. But moving on to like genetic, are there any genetic factors, like specifically your blood type, that could make you more susceptible towards the virus or like protective against the virus?
Yeah, another good question. One of the things I've learned from my colleagues and reading the medical literature on this is that blood type does make a difference. For example, blood type O, you have more resistance to getting COVID-19. In other words, if you had to choose a blood type, choose blood type O. Unfortunately, blood type A had a little downside, with the virus. So, but look, suppose you're dealt a bad set of genes, or suppose you do a blood type A. Well, that's not a death sentence. That's just a messenger. And, if I had blood type A, and I have blood type O, but, you can take minerals, for example. We talked about targeted nutraceuticals, but there's minerals that support the immune system. And one of them is zinc. I'm sure you've heard about zinc. Even New York Hospital was doing a little study looking at zinc versus hydroxychloroquine. And a lot of the researchers think that taking a mere 20 to 40 milligrams a day of zinc, it acts like a hydroxychloroquine in supporting the immune system. So, for a young guy like you, Caleb, if you wanted to take an extra 20 milligrams of zinc a day, I don't see any problem with it at all. Now, remember this, zinc and magnesium, they have like a synergistic effect. So I also like magnesium as well as a mineral, going forward, taking, in this COVID-19 era. And by the way, as a heart specialist, whether it's COVID-19 or not, I still love zinc and magnesium as go-to minerals. Because remember, in males like us, it supports prostate health as well. And magnesium supports endothelial cell function. And in anybody who's hypertensive, higher blood pressures, I really like magnesium because we talked about magnesium being an antidote for high blood pressure. And remember, high blood pressure is a comorbidity for COVID-19. So, it's a lot of alphabet soup and it's a lot of, connecting the dots. But I think that, people can do simple measures in strengthening the immune system going forward.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with medical student Caleb Garard. And today we're talking about the connection between the heart, lungs, and COVID-19, as well as precautions and preventative measures to take for people with pre-existing heart condition. With Dr. Stephen Sinatra, a cardiologist and psychotherapist who has authored and published a paper on personalized nutrition for a COVID-19 era with the American Nutrition Association. So, Dr. Sinatra, you did talk about us getting out and exercising and really using the time to allow to get our hearts functioning, get in an excellent cardiovascular condition. It is challenging now during the COVID-19 era to do this with masks. Okay. And we now know that the COVID-19 the CDC is saying it's airborne, it's not droplet in terms of its transmission. What do you suggest in terms of exercise when we're in the pandemic with this organism that can be transmitted via air?
Well, if you're doing a light form of exercise like walking a dog, or if you're riding a bicycle at your own pace, sure, you can wear a mask. I don't see a problem with that. If you're running, though, and you're jogging and you're really exercising, I worry about a little bit of rebreathing carbon monoxide.
Yeah. Me too.
I played athletics all my life, football and wrestling and all that stuff. And I just can't see myself, hyperventilating with a mask on. So I think under those circumstances, I wouldn't use it, but that's my own personal opinion.
Right. So when you exercise, for example, you go work out, you go probably in an area where there's little or no people, where it's a lot of open air. I'm seeing that. And the precautions are that, you would really distance.
Yeah, I think the social distancing is good. And again, I'm in Florida right now. And it's like I said before, it's hot down here. And I think walking the beach is one of the best forms of exercise, not only because you're walking, but again, because of the grounding effect. In other words, when you're walking on the sand and the tide is coming in on the sand, now you're getting a wet sand. And that wet sand contains a lot of minerals. And if you remember from acupuncture points, the K1 point is on the sole of the foot, right below the big toe. So when you're putting pressure on wet sand, you're connecting electrons, through the Schumann effect, the grounding effect. And those electrons are traveling up all the way back energetically into, across up your dorsal spine into your skull. And it's just amazing that whenever you bring the Schumann effect to the body, it's 7.83 hertz. You're loading the body up with electrons. So you can take electron donors through targeted nutritional supplements. We talked about CoQ10, we talked about, antioxidants, but now you're getting electron donors through your feet. That's kind of cool, and it's free. You know what I mean?
Right.
So, you're back in Nassau County. If you walk on grass or concrete or, brick, that's okay. Walking on asphalt is man-made, so you're not going to get the natural earthing energy, through asphalt. But if you want to walk in the park, barefoot a little bit, I'm all for it. Okay.
If one of our friends listening wanted to get in touch with you, what is the best way to?
Oh, they can basically go to heartmdinstitute.com. My daughter's, she runs that institute for me, and we do some Q&As on that. drsinatra.com is a supplement company that I've been working with for over 25 years. I answer questions on drsinatra.com every week, and I just asked your reviewers to keep the question short. I don't want to read a whole page or a paragraph, because lots of times I'll answer a couple of dozen questions a week. So if it's short, it's sweet.
What is the one thing you would want to leave with our audience when it comes down to heart health during this COVID pandemic?
I already talked about the carbs. I'm a psychotherapist. I would say this: if you're lonely and you're depressed and you're feeling down, let the tears out. Sob, cry. Crying is the healthiest thing you can do to release the heartbreak we've all had as children in our lives. We've all had heartbreak. And heartbreak can lead to heart disease. I wrote that book when I was, and actually in my 40s, when I was training to be a psychotherapist. But I've seen a lot of people with, they're in fear, they're in panic, they're depressed. They must let their emotions out, because when you hold on to these emotions, it's like driving your car with your brakes on. It drives up blood pressure. It distorts heart rate variability. So if I had to give a message, I would say to let down into your feelings. If you're feeling sad, if you're feeling depressed, let the energy out. Let the crying out, because if you can do that, you'll help survive heart disease by letting those emotions out. So I think that's the thing to really do, is be real with yourself, be authentic. Don't bury the emotion, just have it.
That's awesome. Thank you so much for being here, Dr. Stephen Sinatra, a cardiologist and psychotherapist who has co-authored and published a paper on personalized nutrition for a COVID-19 era with the American Nutrition Association. We hope you stay safe and continue to do the great work that you're doing. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with medical student Caleb Barad from the Cooney School of Medicine. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.